with the Division of Developmental Disabilities Federal Programs Unit, and I am part of the DD Health Home team and want to thank everybody for joining us today and taking time to hear about this exciting initiative that the Division of DD is embarking on. And I'm going to go around the room. We are here in Central Office in Conference Room A, and I'm going to let the DD Health Home team introduce themselves before we get started. So I'm going to pass it off to Donna Siebenek.
So good afternoon, Donna Siebenek. I am the Medicaid liaison for the department.
Good afternoon, I'm Amy Volkart, and I am with the Medicaid reimbursement unit with the department.
All right. This is Melissa Jones with DD. Jennifer Bax with the Medicaid and Reimbursements Unit.
Michelle Clark with the Director's Office.
Corey McMahon, DD.
And then it looks like we have Kim Stock. Kim, if you want to introduce yourself as well.
Good afternoon, everyone. Kim Stock with the Division of Developmental Disabilities.
Okay, and we have several other team members who are not with us today, but we are a small but mighty team that has been working on this, and we'll go ahead and get started. So as Kat said, if you can go ahead and hold your questions until the end of the presentation, put them in the chat, you can put them to the panelists, and we'll make sure that we go through them at the end for you and try to get you some answers. For those of you here in the room,
You may want to ask if they can hear you now.
oh, okay. Can everybody hear me now? Is this better? Kat, am I coming through okay?
Yes. They had just asked you to speak up. That's all.
Oh, sure. Okay, thank you so much. And for those that have joined us here in the room, if you have questions, of course, you can ask them. You can also write them on index cards. We have those. Whatever works easiest for you. So what we are presenting here today is a proposed vision for the DD Health Home. The division is working with the Missouri Department of Social Services MoHealthNet Division, or Medicaid, to implement a DD Health Home. A DD Health Home will help coordinate care for individuals served through the division who have a qualifying health risk and chronic health conditions. Before the DD Health Home can begin providing services statewide to individuals who qualify, approval must be given by the Centers for Medicare and Medicaid Services, or CMS, through what we call a state plan amendment, or SPA. The SPA is a CMS requirement that helps the division plan, implement, monitor, and conduct quality services through the DD Health Home. What is a health home and what can it do for eligible individuals? A health home can help support individuals in managing chronic health conditions, medications, and medical treatments. It assists individuals with meeting their healthcare goals and provides information about general wellness, healthy eating, or exercise. The health home team will partner with an individual's planning team to identify and address specific healthcare needs as well. Now, while it's important to understand what a health home is, it is equally important to understand what a health home is not. And a health home is not a home. It is not a place where you live. It does not change where you live. It is not direct medical services. That means it's not like your doctor's office or going to the hospital. It does not change an individual's planning team. It actually adds another partner if the individual so chooses. And if the individual makes the choice to participate in the DD Health Home, it will not affect an individual's current MoHealthNet or Medicaid benefits or services. A DD Health Home is an additional service option for Medicaid-eligible individuals served through the division. This includes individuals in waivers and individuals not receiving waiver services. With identified health risk and chronic health conditions, individuals can choose to participate in this service if they qualify, and we will get to the DD Health Home eligibility requirements on the next slide. Individuals in the DD Health Home program will have access to a team of qualified healthcare professionals that promote wellness and healthy lifestyles while focusing on person-centeredness and individual choice. The DD Health Home team will also support an individual's existing planning team, and individuals will be supported to identify their overall health outcomes, health risk, learn how to address their health risk, and improve the management of their chronic health condition, which therefore improves their overall health and wellness. So keep in mind, all of this support will be driven by the individual and their identified healthcare needs and goals, so it will be person-centered. Providers are being proposed to be DD targeted case management and accredited or certified DD HCBS waiver service providers.
This slide provides information regarding the DD Health Home eligibility. Again, as Leslie mentioned, the intent is to serve adults and youth with a developmental disability who are eligible for the Division of DD services, whom also have a health risk screening tool, or HRST, that's been completed, and they have an identified healthcare level of 3 or greater that's tied to the actual health risk screening tool, and have one or more of the chronic health conditions that are listed below that include diabetes, asthma, cardiovascular disease or hypertension, chronic obstructive pulmonary disease or COPD, overweight with a body mass index or BMI greater than 25, dementia, dependent on a ventilator, one or more of the following conditions that would possibly place the individual at risk of developing another chronic condition, which would include pulmonary aspiration, bowel obstruction, gastroesophageal reflux disease or GERD, seizures, sepsis, dehydration, tobacco use, and lastly, diagnosis of autism spectrum disorder.
Thanks, Kim. So let's talk about auto-enrollment and what this means. When the DD Health Home is approved, individuals eligible for the DD Health Home program will receive a letter notifying them of their provider's name and that they will be receiving a call from their provider. So first, individuals can request to change DD Health Home providers or stop receiving DD Health Home services altogether. There is no charge to individuals for this program, and participation in this program is not required. It is the individual's choice to participate. Participation in the DD Health Home program will not affect their MoHealthNet or Medicaid benefits or other Medicaid service. Regarding provider infrastructure, providers will be enrolled statewide. The division will auto-assign individuals to providers within the division's 5 regions, which is Central Missouri Regional Office, Kansas City Regional Office, Poplar Bluff Regional Office, St. Louis Regional Office, and the Springfield Regional Office. If you are receiving waiver services or support coordination services from a provider who decides to become a DD Health Home provider, then you would be auto-enrolled with that same provider. There are 6 statutorily required health home services, which include, and we will summarize these for you here, comprehensive care management, which is the initial and ongoing assessment of an individual's healthcare needs and supporting an individual with development of healthcare goals to promote wellness and management of chronic health conditions. Care coordination assists the individual with implementing and meeting their healthcare goals, monitoring progress towards these goals, and coordinating care with multiple providers, such as primary care, acute care, behavioral health, and long-term services and supports. Health promotion is education and engagement of an individual in making decisions that promote healthy lifestyles and improve their overall quality of life. Comprehensive transitional care from inpatient to other settings is supporting the individual and the family or caregiver when the individual is transitioning between settings such as a hospital, nursing home, rehabilitation facility, community-based residential setting, or back to their own home. This service can also be provided when an individual chooses to transition to a new health home provider. Individual and family support is coordination of information and services to support individuals and their family caregiver to maintain and promote a healthy life with a focus on community living. Referral to community and social support services, providing information and referral to individuals and their family or caregiver on community resources, regardless of funding source, that can assist the individual with meeting their healthcare goals.
Okay, the per member per month rate, Missouri will pay DD Health Homes the cost of staff primarily responsible for the delivery of services not covered by other reimbursement. This will include a health home director, a physician consultant / nurse practitioner, nurse care manager, specialized healthcare consultant, and DD Health Home facilitator. These duties cannot be otherwise reimbursable by MoHealthNet. The health home per member per month also includes specific training, technical assistance, administration, and data analytics. All health home providers will receive the same per member per month, and the rate is still being developed. It is not finalized yet.
Thanks, Donna. DD Health Home provider positions. As mentioned, the DD Health Home team provides individuals with a team of qualified healthcare professionals that promote wellness and healthy lifestyles while focusing on person-centeredness and individual choice. The DD Health Home team will include a health home director, nurse care manager, physician consultant, nurse practitioner, specialized healthcare consultant, and DD Health Home facilitator. The physician consultant will be an and/or with the nurse practitioner. Specialized healthcare consultant includes one or more of the following: behavioral health consultant, dietitian, occupational therapist, physical therapist, or speech-language pathologist. The health home director is responsible for championing the health home program and integrating physical and behavioral health, prevention, and wellness, managing health home enrollments, discharges, and transfers, and overseeing the daily operations of the health home. The physician consultant or the nurse practitioner, now keep in mind, think of these very different than a primary care doctor or a nurse practitioner that you would see for medical treatment or for your annual physical. This position stays very general and establishes organizational priorities for disease management and improving health status, participates in case consultation with the interdisciplinary teams, helps educate clinical and direct care staff on the nature, course, and treatment of chronic diseases, and develops collaborative relationships between the organization and treating primary care physicians, between primary care physicians and psychiatrists, and between the organization and other healthcare professionals and facilities. The nurse care manager is responsible for overseeing the health trends of the entire population of individuals in the health home, following up on identified trends, participating in health education activities, including topics on smoking cessation, disease prevention, and medication adherence, as well as completing medication reconciliations for health home individuals post-hospital discharge. The specialized healthcare consultant will focus on managing a population of individuals versus specialty care. They support the care team and the individual in identifying and behaviorally intervening to improve and manage the individual's physical health condition, assist with the medication adherence, treatment plan adherence, self-management support, goal setting, and facilitate staff trainings within the DD Health Home. It also allows the DD Health Home to have the flexibility in offering additional consultation from a variety of healthcare professionals for special populations. And last, the DD Health Home facilitator will have a close understanding of the community that they serve and serve as a liaison or link between health and social services and the community to facilitate access to services and improve the individual quality and competence of service delivery. The DD Health Home facilitator tracks and facilitates individual enrollments, transfers and discharges, schedules meetings and appointments, facilitates information exchange, tracks the individual's hospitalizations, discharges, and ER visits, tracks and facilitates health screening completions, supports information technology functions, and in general supports the care team and their operations. So to quickly recap, the DD Health Home is not a physical home. It is a program that helps coordinate services and connects individuals to resources for their healthcare needs and goals, which helps them live healthier lives. Participation in the program is not required, it's voluntary. The proposed implementation date included in the state plan amendment is January 1st, 2024, with many development and implementation steps between now and that date. So before we take questions and feedback, I did want to give you these links and this email address if you would like more information on the DD Health Home, if you're interested in receiving coordination services through the DD Health Home once the program is implemented and approved, or if you're interested in becoming a DD Health Home provider, you can email the division at ddhealthhome@dmh.mo.gov, or you can visit the DD Health Home webpage at the address listed here. And it looks like Kat has dropped both of those in the chat. Thank you, Kat. And now we will go ahead and open it up to questions. Well, you're more than welcome to make questions. Kat, have we had any questions in the chat?
No, none so far.
I have one, if that's all right.
Yeah.
Linda Nelges with MX. How will this affect or replace or somehow modify TCM services or marry into the home health situation? I mean, how does that affect the TCM? Will it take the place of any of the services that the TCMs provide right now?
Linda, that's a great question, and no, it will not. This service will work in harmony kind of with the TCM and the support coordinators. It is not a direct service, as you know, and they will partner with support coordinators to address the individual's identified healthcare goals. I do have notes for that, Linda, because I knew we would get this question. So hold on just a second, because we have a response for that. Let me get my readers on here. So DD Health Home is basically a high-level care coordination service that looks at the big picture and works with the individual and their existing planning team with establishing person-centered healthcare goals and health outcomes. And that includes management of chronic health conditions and identified health risk. And as we discussed, it's person-centered, it's really driven by that individual, and of course they have choice, and it supports that individual with how they want to address their chronic health condition and really listens to them to help them to be successful in addressing their health and wellness. And as we said, they have choice to participate in this program or they could opt out. So it's really looking at the whole person and bringing everyone together to really assist that individual with their health so that everyone's not working in silos. They're all working together to help that individual address their healthcare goals. And if anybody else would like to jump in, if I left anything out, please do.
I just wanted to ask, and is not that what a TCM does, is bring everyone together and do the management of the care of the individual so that they have a productive life? I mean, what is the difference?
So we have discussed that as a team, Linda. And so, yes, you're correct that support coordinators do assist individuals with habilitative habilitative needs, and then also identifying support needs that they might be. The difference would be that this is focused on healthcare goals, and the health home specializes in that and would therefore assist. It would be more of a coordination between the two, with the health home focusing on the health and wellness and the support coordinator focusing on those habilitative needs that the individual has. And we're not saying that the support coordinators don't, at times, do, address health and wellness, correct?
Right.
But the health home has the specialty to focus on that, and the knowledge and the expertise, the professionals to do so. That's a great question, Linda. Thank you. Looks like we've got some questions coming in. Looks like we've got some questions coming in the chat, Kat.
Okay, I can start with those. Is this a service that we would request through the waiver?
No, this is not a waiver service. This is a state plan service, so this would not be requested through the waiver. And I can go back to that eligibility screen just so you have those eligibility requirements. But again, this is not a waiver service. This is a state plan service. Great question.
Okay. Give me 1 second. Next question is, so this is a state plan service only?
Yes.
Okay. If an individual is already enrolled in a PCHH or BHHH, it is assumed they would not be also enrolled in a DD health home unless they are choosing to transfer their HH provider.
That is correct, yes.
How is this separate from the HRST?
Oh, Kat, before we go to that one, okay.
Yes.
I'm gonna pass that one off to Kim then.
Okay. Yeah, I'll be happy to pick that question up. So the HRST process, the health risk screening tool process for Missouri, is just that. It's the utilization of the health risk screening tool, which is a standardized electronic instrument to detect health risk in early areas of destabilization to support the individual and enhance planning. So it's a tool and information that could be shared with the DD Health Home provider, again, to assist them in their role as that particular program. They're distinctly separate processes. The criteria, as you notice here on the slide 4, does indicate, though, that some of the eligibility criteria requirements are that the individual would have a health risk screening tool completed, and again, that they would have a healthcare level of 3 or greater as part of their eligibility for the DD Health Home.
Thanks, Kim.
Okay. Is this similar to the caseworkers assigned to individuals who have advanced Medicare service, Medicare Part C, I believe? I believe Illinois State has this set up.
I am not familiar with this program, so I do not believe it is, because it is a state plan service. It is not a Medicare service. I cannot answer that question because I'm not familiar with that program.
How does this interact with HRST, which also establishes healthcare plans / goals, correct?
Leslie, I can take that question as well. So yes, there will be interoperability between the DD Health Home programs providers and their information and what they've identified, and they will have access to the HRST information as well. Also working on a proposal that any identified healthcare goals through the Health Home program would integrate over into any applicable health risk support plans that are developed by the individual, again, to enhance planning, risk mitigation, and improve overall health outcomes.
How does this differ from the nurse case managers through an individual's PCP, or will this be covered later?
If I'm understanding the question correctly, nurse case managers work directly with the care provider for that individual's services, and so it's a direct service. As Leslie mentioned earlier, the role of the DD Health Home provider is not a direct service. Leslie, I don't know if you have anything to add on that response.
I don't think I do, no. Kim, I think you covered it well, thank you.
What is the process for an entity to apply to be a health home provider? What is estimated date for determination of the PM rate?
Donna, okay, what is the process for an entity to apply to be a health home provider? So we are working on an application process and a designation process for those interested in becoming a provider. At this time, we would ask that you reach out to the DD Health Home email box if you are interested. And as that comes into development, we will be reaching out to those who are interested and helping you with that process. And then I'm going to turn it to Donna for the PMPM question.
So we are working on the development of the per member per month. Our plan is to hopefully submit the state plan amendment to CMS spring. I'm hoping for March submission. At that time, we will have to have the per member per month developed.
Okay. So is this just an opportunity for residential RN to do more and thus bill more to support the health of individuals, as long as the residential DD provider contracts to become a health home?
Kim, do you want me to take this one or do you want to take this one?
I see it as a two-part question, Leslie. If you want to respond to the question in regards to the residential provider and then becoming a DD Health Home provider.
Okay, so this is just an opportunity for residential RN to do more and thus bill more to support the health of individuals. So let's take that one first. So as we said, yes, DD HCBS waiver providers will have the opportunity to become a DD Health Home, but that is separate from waiver services. That is separate from residential RN service. So it is not one and the same, and thus they would not be duplicating, supplanting what a residential RN would do, and the residential RN would not be doing the DD Health Home service. They would be totally separate. As long as the residential DD provider contracts to become a health home. So I think we answered that in the first part. Those are two separate and distinct services. Kim, did you have anything to add to that?
No, I think you covered it. Thank you.
Okay. Will health home providers need to be accredited or recognized through a nationally recognized body such as NCQA?
Health home providers will need to be contracted with Division of DD to provide targeted case management services, or they will have to be an accredited, recognized by the division, or certified HCBS waiver provider. I'm going to look to Miranda. NCQA is not a recognized accreditation by the Division of DD, and I'm not sure what that stands for either.
National Committee for Quality Assurance.
If you can let us know what that is, but that is not an accrediting body that is recognized by the Division of DD.
I'm not seeing any more questions. I see a statement, but not a question.
So that is currently residential RNs could do more than just 1.25 hours per month, but they will not get paid. If they could get paid, they could do more to support the health of individuals in DD residential services.
No more questions so far.
Kat, is there any way to open up the line so that someone could come on and ask a question? Is that possible?
I can try to do that but with so many on here, people could be talking over each other.
Okay. Okay. Yeah, and they can't raise their hands, so. Okay, we'll give it a few minutes, Kat, and see if anyone thinks of anything. Anyone in the room have questions? After all that, those were very good questions, so, and we really appreciate those. We really do. It helps, it gives us feedback, it makes us think, it helps in the planning and the development of this as we're going along and working with stakeholders and trying to figure out what you need to know and what we need to get out and educate about. So this is very, very helpful to us, and we really appreciate this.
They can raise their hand if they'd like.
Oh, great. Okay. So they have that option, Kat, to raise their hand?
Yes, I changed the setting.
Perfect. Thank you. We'll see if anybody raises their hands. Please feel free to do so. So we did see a question in the chat. I know it's stated in the presentation, individuals were auto-enrolled. Can you explain that process in more detail? How will the TCM be notified someone is enrolled in the program? Those are great questions. And we are still working, this division team is still working on all of those details. And we will be figuring all that out before we hit auto-enrollment. But basically, we are going to find out who qualifies based on the eligibility requirements that we showed you on the previous slide. And then if someone scores a HRSA level of 3 or greater, and they have one of the qualifying health conditions that was listed, then they would qualify, and their Medicaid is active, then they would qualify for the DD Health Home, and they will receive an auto-enrollment letter in the mail. So our plan is to get as much education out to individuals as we can between now and the time that this goes live in January 2024. And please know that they have the right to opt out. They can choose a different provider. Again, we're working all that out, so I'm not sure that we have all the details about how the TCM will be notified. But that is a great question. And again, if that individual's, let's say an individual is currently with a TCM provider or an HCBS waiver provider receiving services, and that provider decides to become a DD Health Home, then we will be keeping that individual with that provider unless they choose a different provider.
So what if both providers are health homes?
That's a question that we've asked too, Darla, so we are working on that as well.
Yeah, I think somehow have to fall into that algorithm of how you auto-assign. I said that I think to answer Darla's question, that will fall within the algorithm that we're working on when it comes to assigning individuals.
If they're both if they're receiving both from the TCM provider and the HCBS waiver provider who are both a DD Health Home. Where do you gather the information about individuals' health diagnosis? So currently, we have been pulling that information from claims data, Medicaid claims data. NCQA is National Committee for Quality Assurance. Being contracted, okay, just to clarify, being contracted as TCM or certified HCBS provider, as you described, are the only qualifications. No requirement to also obtain certification, accreditation, or recognition status as a health home provider. So, yes, to clarify, so you have to be a TCM or a certified accredited HCBS provider, and there will be requirements that the division is currently working on in order to designate a DD health home provider. So there will be requirements that you need to meet. And I don't know if anybody else wants to say any more, but we are working on those now as a team.
And that designation process will be occurring and provided through the department's licensure and certification unit.
Yes, that's correct. Thank you, Kim. If a TCM provider contracts to be a health home provider as well, is that conflict-free? So we have discussed that as a team as well, and like we talked about when Linda first asked her question, that yes, those are two distinct and separate services. There will have to be safeguards in place to ensure that the TCM provider is separate and distinct from the DD health home provider. But that would not fall into a conflict situation.
So to add a question to that, so a service coordinator with the TCM entity would not also be able to do any health home services for the provider they're enrolled with. And the only reason I ask that is because there could be overlap in what a TCM service coordinator does, because their care coordination sometimes, as you stated before, does address their health. So if you have a service coordinator documenting something that falls within line of what the health home does, we as an auditing agency, we will see the TCM note, but we would not see anything done by the health home. So how do you keep, so that they're not billing, do you see what I'm saying? And I realize the health homes get paid on a per member, per month basis, but if all of their contact with the participant ends up being also coded as TCM services, how do you know that's not a duplication of services?
So, Darla, you're asking if an SC would be working under the DD Health Home PMPM. And I don't believe they would, because that is not a support coordination service. So it would have to still be separate and distinct. So what the SC does would be, they would not be able to do what the DD Health Home would be providing for that individual under, you know, an attestation service, one of those services that we talked about, the 6 that we are required. So I don't think that there would be any way that there would be an overlap with their, I'm looking to Donna.
I don't think so. The only thing I could think of is, let's say that, you know, you've got an SC that's half-time working TCM, and then that SC serves half-time as maybe the facilitator, just throwing out one of those positions. They could do both positions, but both of those should be clearly documented. You know, you should be seeing, I think, on the SC side that they're only doing 20 hours a week, and the other side should be documented somewhere within that per member per month within the reporting requirements that they were serving here. So if you would see 30 hours of billing, I think that would be a problem, because they're really 20 hours here, 20 hours here, because they're two part-time positions. Because we do believe we're going to see some overlap maybe in some of the higher positions, thinking of like your nurse care manager, because when you put these ratios out of 1 to, what, 250 or whatever they are, we're not projecting that many enrollees. So health home provider may not get enough that they need a full-time position.
Right.
So you may see some where they do this half-time, that half-time. But
Right.
there should be clear documentation, in my opinion, in the records
Yeah.
to show that.
Okay.
Yep, I agree. Thank you, Donna. Yeah. Will nurse care manager be required to be RNs? Kim, do you want to take this one?
I can. The current requirements for the nurse care manager are not that they would be required to be a registered nurse. They could be a licensed practical nurse as long as there is an RN functioning in the other roles of the health home team so that they could provide the direct oversight and supervision of that LPN. And we have had consultation with our other healthcare home providers currently within the state of Missouri, and it's our understanding that there are some RNs who function in that capacity as the health home manager. Leslie, is that the correct position title?
Health home director.
Director, thank you.
Not seeing any more questions?
I'm not seeing any, Kat. Has anybody raised their hand?
No.
Okay, again, we have the ddhealthhome@dmh.mo.gov email. You can email us any questions, any feedback. We appreciate all of it. We really do. And we appreciate you taking time today. Kat has been recording this webinar, and we will be posting it there on the DD Health Home webpage, that address that you have there. And not seeing any more questions, I think we're going to go ahead and thank everybody for joining us. We're going to have another one Thursday. Actually, we're going to have two more Thursday. We're going to have one from 11 to 12, and then also 6 to 6:30. So if you know of anybody who can maybe make it after work, we'd really love to have them join us and ask questions and give us some more feedback. So appreciate you all. Thanks for joining us today, and we'll talk with you soon.